Hello, it's Dr. Sheila Kilbane, integrative pediatrician in Charlotte, North Carolina, and I am so excited because Deb, our wonderful integrative pharmacist who has joined our Infinite Health team, is doing a talk this coming week on gut health. Deb, would you tell us a little bit about your talk and why you have such a passion for gut health?
Certainly. What I've run into throughout the course of my life is one very significant event which happened in 2004, and that's when I gave birth to my preemie triplets, and giving birth to them showed me that gut health is so important to start with, and how to nourish them and help them rebalance and heal and move out of, so much so that I had to actually move out of traditional pharmacy and start to work in the integrative realm.
Wow. Now, I've heard you say it, Deb, that they were on Miralax, which is a laxative, they were on inhalers, antacids, several different medications, and it wasn't until you started really questioning that you realized that didn't have to be the norm.
Exactly. All those things that I had reached to and directed people to through so many years, I started to realize that my children weren't born with those as a deficiency, and we really needed to start questioning those things.
Awesome. And so Deb is going to head up our adult program, and she's going to start doing adult consults for gut health. And what kind of things, if you are an adult and you have some health issues, what kind of things would you have to know that you had leaky gut?
Well, it looks so different because as parents we see it as eczema and reflux. And then as adults we start to say, well, as we get older, well, we have some, I can't eat that anymore, or it's not agreeing with me as much, and we start reaching for antacids and reflux meds, and we may even start to have hormone imbalances. So what I think is that we just need to start looking back at the core, which is gut health.
Yep. So just what Deb was saying, it will be things like heartburn and body aches, aches and pains in joints, and it can be irritable bowel syndrome. So the headaches, loose stools or constipation, skin issues, bumps on the back of the arms. So lots of different things, and rheumatoid arthritis and thyroid disease and heart disease and diabetes. So we know that inflammation is what triggers a lot of these things. Now, we used to think that cholesterol caused heart disease, but we now know that inflammation is really the big trigger. So anyway, we do have some spots left for this upcoming talk. So if you are interested in joining us, just call our office, 704-626-6771, and talk to Jennifer and she'll get you registered. And visit our website if you want any more information, and it's SheilaKilbane.com. Thank you so much.
Looking forward to it.